Hi, this is Dr. Bharadwaj. Today we will discuss on the important topic that is defined data. Okay, DFINE data. In this defined data, what we discuss is first what is data. Okay, then we discuss how do we get the data in a medical scenario. How do we get the data? So data is from two places. Once you are treating a patient. Okay, one is clinical practice, you get the data. Next one is research, medical research, whether it is clinical research or preclinical research, you get the data, medical data you get. And third one is different types of data, basically different classification of data. When you have data, how to classify the data, in various, so based on different criteria a data can be classified. This all comes under defined data. Define data. So what is data? Data is information. Any kind of information collected is data. And more scientifically, what is data is actual values collected for a variable. If you have any variable, for that variable if you are collecting any data, that is also for that particular variable, if you are collecting any information, that is also known as data. Then what is variable? Variable, a characteristic or property that can have different values. For example, blood pressure. Blood pressure is a variable. It can have any value. It can be 120 by 80, 140 by 90. It can have different values for it. Here, blood pressure is a variable and it can have any value. Human temperature is a variable. It can have any value. 98.6. It can have 100. It can have 200. I have seen the patients with fever of 108 as well. So human temperature is a variable and it can have any value. All those values comes under data. Here you have understood here what is data and what is variable. And the next important thing we are going to discuss here is source of data. In medical field, how do you get the data? First one is clinical practice. In clinical practice, how do you get the data? First one is symptom. Symptom is a subjective feeling told by the patient. And second is sign. Sign is objective finding that can be perceived by touch, palpitation, taste, gustation, see, vision, hear, auscultation, smell, olfaction. By using all these senses, a doctor can get the data. This data is recorded, that is by sign. Next one is investigations. Any investigations, it can be biochemistry investigation, it can be radiology investigation. All these investigations can be, these are also the signs that can be perceived not by humans, that can be perceived by devices or machine. These are all comes under investigation. All investigations are considered as data. Next one is history of the patient. Who tells the history of the patient? Either patient will tell or his attendants will tell. Both are considered as history of the patient. Next one is the latest technology is wearable devices, CMG, continuous glucose monitoring. You wear a small device and you can monitor your glucose continuously. Or ECG, there are some devices where I have seen just you have to place it on your chest, it will record the ECG completely. One more common one is steps, how many steps you are walking per day, or pulse oximeter, you have to just put onto your finger, so it calculates the amount of oxygen present in your blood, percentage of oxygen in your blood, and also it calculates the pulse. These are all the latest advancements in medical field, how you collect the data. And coming to the case, what are all the things you collect in the case? One is demographics, what is the age of the patient, what is the name of the patient, all those things. Okay, or comes under demographics, from where he is coming, all those under demographics. Next one is illness, presenting complaints or history of present illness, history of past illness, family history, all this comes under data. Next one is examination, both general examination and systemic examination. General examination, height, weight, BMI, all those comes under general examination. Systemic examination, system wise, respiratory system, what are all the information you are collecting, reproductive system, digestive system, nervous system, all that comes under systemic examination. Next one is diagnosis, all your diagnosis, what is the differential diagnosis, provisional diagnosis, investigations, final diagnosis. Even investigations comes under data. All this is data. Next comes to personal history. So physical history, how physical and physiological history. This is mainly for homeopathy patient. How he is reacting to cold. How he is, what type of water he is taking, what type of food he is taking, his desires, aversion. This is purely homeopathic case taking. It can be used for other people also, but personal data includes physical, physiological data and psychological data. And that means mental symptoms. Mental symptoms. So will, understanding, memory, his personality, his emotions, everything comes under data. And social data, right? How is his reproductive status, how is his social status, how is he interacting with the society, all those comes under social status. Next is even repertory, analysis of the repertory, analysis of the symptoms, evaluation of the symptoms, repertorization, everything is data here. And finally prescription. So what is the medicine, what is the potency of the medicine, how to repeat the medicine, what is the dose, how many times to use per day, all this comes under prescription. Even that is considered as data. Next one is prognosis. When the patient comes for further visits, you update your prognosis notes and you write in the prognosis, and you prescribe the new medicine or you stop the medicine, you change the medicine, all that comes under data. So in, when you are a clinician and you practice medicine, this is the symptoms, this is how you get the data. And next important thing is clinical research. In clinical research, how do you get the data is very important topic here. In clinical research, whether it is preclinical research, how you do on animals, on clinical research when you do on human beings, what are the ways you collect the data is important. One is CTMS, clinical trial management system. It is a software where you can plan a clinical trial, you can track a clinical trial, you can manage a clinical trial, monitor and close a clinical trial. End to end details of the clinical trial are captured in this software. This is a common software used in all clinical research, that is known as clinical trial management system. We call it as CTSM, CTMS. This is the first system. Next one is ECRF, electronic case report form. How we collect the case? So starting from demographics to presenting complaints to finally prescription and progress notes, all those things which are related to a patient in a clinical trial is collected in electronic case report form. It is a digital version of case report form where you collect, record and manage clinical trial data electronically. This ECRF is particular to a patient, or in clinical research scenario we call it as subject. This is related to a subject. CTMS is related to entire clinical trial. In CTMS, what do you have? In how many countries the clinical trial is going on, in how many countries, how many, in each country how many sites are there, so in each country how much drug is present, in each country how many investigations are present, in each country how many patients are present. This clinical trial management system is the whole clinical trial, but ECRF is related to a particular patient. Each patient will have a ECRF and ECRF number. Each trial will have a clinical trial management system, single clinical trial management system, and it will have a number. Okay, this is about clinical research. And what are all the other things in clinical research? Next one is e-consent, electronic consent form. Normally electronic consent form is taken in a paper. When the patient comes, a paper is given and sign is taken at the end. But as the technology advanced, now complete digitalization of consent has taken. There are some systems which take only work for taking the consent of the patient, that is known as electronic consent form. Consent form is approval of the patient to join the clinical trial. Every patient has to be every patient has to give approval to join in the clinical trial. That is mandatory. That can be taken in electronic form, that is e-consent. Next one is ETMF, electronic trial master file. Electronic trial master file is kept at a site. Every site will, site means a hospital where the research is going to happen. That is, so hospital in clinical scenario, site in clinical research scenario. Hospital and clinical site are same. When you are speaking about clinical research, you call it as site, not as hospital. Every site where clinical research happens will maintain a document. Previously physical documents are maintained, now electronic documents are maintained. So these are essential documents. Electronically they can store the data, they can organize the data, and they can manage the data, they can retrieve the data. details about particular site. So how many patients are there, all the patients consent forms are kept in that trial master file, a protocol is kept, all the documents are kept in an electronic format at the site in ETMF. Okay, next one is ECOA. This is very important one, electronic clinical reported outcomes. What is electronic clinical reported outcome? So previously, if you ask any question to the subject, he will answer, right? All those things can be captured in electronic form. So basically this is a system used to collect the details of the patient by the patient. It can be, see, if X is a patient, he can tell about his condition by himself, or when the patient comes to the clinic, a doctor can assess the patient and give the details. Those details are captured. That can be by clinician or observer. In normally this happens in unconscious patients or psychiatric patients where they cannot tell about themselves. In that cases, that ECOA form is given to a attendant of the patient, so that he will report how he is improved or how he is deteriorating. All those details are captured in ECOA, electronic clinical reported outcome. This is also one of the systems used in clinical research. Next one is ePro, electronic patient reported outcome. This is similar to ECOA when it is done by the patient, when the assessment is done by the patient. For example, there is EQ5D, Euroquill 5D is a type of questionnaire where it is given to the patient who is participating in the clinical trial, and he is asked to rate it. It is just like a rating scale, or it is like a pain scale. So before starting the clinical trial, what is the pain? Is it 1, 2 or 3? After starting the clinical trial, what is the pain in the scale? All those can be captured in ePro, electronic patient reported outcomes in clinical trials. Next one is wearable devices. This is the latest one. There are many clinical research companies where making these wearable devices. For example, they want to monitor the heartbeat. Some patients will have cardiac arrhythmias. We don't know when the cardiac arrhythmia will come. So a small device is kept on his chest and monitored continuously. So that type of devices, or if there are any abnormal electric signals from the brain, there are certain devices which are kept on the skull, so that devices capture the electronic signals continuously. There are different varieties of wearable devices or other devices that can be inserted into the body, wearable or inserted into the body. Those capture the details as well. Those are also used in clinical trials. Next one is IRT, interactive response technology. Same system is called randomization trial supply management, RTSM, or it is known as CIS, clinical interactive system. These are the same system. We call it as IRT, RTSM or CSI. What does this system do is, it will assign the treatment to a patient. After assigning the treatment group, based on the treatment group, the patient will be given a medicine. So if it is placebo, it will give placebo. If it is active, if it is he is assigned to active group, it will give active. If he is assigned to placebo group, it will give placebo. So it is used to assign the treatment group. After assigning the treatment group, based on the treatment group, medicine is given. And also supplies distribution. If the main sponsor is in US and the clinical trial is going on around the world, maybe India, Pakistan and China, how do the medicine come to India? How do the medicine go to Pakistan? How do the medicine go to Sri Lanka? So this system is used to distribute the medicine. Once the medicine is distributed, trial medicine is distributed, once it is used, it has to be brought back, it has to be accounted. That is known as accountability. Supplies accountability, supplies distribution, supplies accountability. All these details are captured in this RTSM system. This is one of the commonly used system used in the clinical research. Next one is pharmacovigilance. Pharmacovigilance is when the clinical trial is going on, there will be some adverse reactions, side effects. How do you capture those adverse side effects and report it to a particular regulatory authority? If the clinical trial is going on in India, so Indian government should know what are all the side effects that clinical trial is producing. For that, they use safety management systems. In this way, in clinical research, there are a lot of systems. These are only the important ones. There are other minute ones which are used in clinical trials. All these are the systems used in our clinical practice and clinical research used to collect the data. Next one is classifying the data. You have a lot of data. See, there are various forms of data, right? How do you classify the data? You cannot put everything at one place, right? You have to classify it. Basically, data is classified in three main ways. First one is based on the source. Where are you getting the data from? So that is the source. Next one is structured, how the data is organized. Based on the organization of the data, the structure of the data, is it in columns and rows? That's how data can be classified based on the structure. And the next one is based on the nature of the value. So what is the value? Is it a name of the person, or it is the age of the person, it is the height of the person? What is the nature of the value or the nature of the data collected for a variable? The data is classified mainly on this three bases. We will check one by one. First one is based on the source, from where the data is getting. Based on the source, data is classified into primary data and secondary data. These are the two types of data based on the source. What is primary data? You have to be careful here, this is very important. This is the first collected data. Okay, primary data is the first collected data by an individual or organization. Who collects it? By an individual doctor or an organization or a hospital for a specific purpose. Okay, you have to have three things. It has to be collected first. Okay, then it can be by individual or organization for a specific purpose. It should have purpose. Let's take an example. Systole and diastole blood pressure is collected, right, from a patient. Okay, systolic value and diastolic value is collected from the patient when the patient comes to the hospital. Collected by the doctor. Who collected it? It individual or organization, a particular doctor collected it. Doctor in a hospital collected it. What is the purpose? For treating the patient. Okay, you have first collected, first the doctor has collected, the person is the doctor and or a hospital, and the purpose is treating the patient. This is primary data. What is secondary data? Very important. Previously collected data. This is not collected first time, this is previously collected data and it is reused by an individual or an organization. Okay, someone has collected the data, that data is reused by a particular person or an organization for a different purpose. Okay, previously the data was collected for different purpose, now the data is being reused for different purpose. Example, the same one. In a particular hospital, a doctor has, the patient has come, he has taken systole and diastolic value and entered into the case report in a hospital, and he gave the medicine to the patient and he sent him away. After some time, a research in the same hospital, a PG has come, a postgraduate has come, and he want to make a thesis on blood pressure. Okay, some thesis on blood pressure. What he does, he goes to the previous documents, he takes the systolic and diastolic blood pressure from the hospital case sheet. Okay, this is reused by the PG student or an individual or again an organization for his thesis. This is different purpose. Here in primary data collected first. Okay, here previously collected data, here reused data by an organization or individual, here also by organization or individual for specific purpose, for different purpose. Here what is the purpose? For PG thesis. What is the data? It is not first collected, it is previously collected and it is reused. So that is the difference between primary and secondary data. This is important here. What is the next way of classifying the data? Based on the structure, how the data is organized. Based on structure, data can be classified into structured data, unstructured data, and it can be classified into semi-structured data. This is important. This is a technical concept everyone has to understand. So what is structured data? First, data that is organized in a particular format, any format it can be. Normally when you take Excel spreadsheet, right, the data is arranged in the form of rows and columns. For example, first row is for a patient, right, patient 01. Second row is for patient 02. Third row is for patient 03. Here the data is collected in the form of rows, and in the columns what do you have? In first column you will have age, in the second column, in the first column you will have age, in the second column what do you have? You will have date of birth, in the third column is temperature, is BP. Here the data is arranged in the form of rows and columns or any other format. in the form of rows and format, rows and columns. Normally data is organized in Excel spreadsheet. When you take an Excel spreadsheet and you give first row for first patient, second row for second patient, and each column for each parameter, age, date of birth, whatever you want. When the data is structurally arranged, that is known as structured data. Best example is Excel. In Excel you arrange data in the form of rows and columns. There are some databases, RDBMS, relational database management system. Here you save the data in the form of fields and records. Here record means horizontal one is a record. In Excel it is equal to row. Vertical one is a field. Here there you call it as column. In database language you call it as fields, and vertical ones are known as records. Okay. When the data is organized in Excel spreadsheet or in databases, it is known as structured data. What is unstructured data? Data cannot be organized into any of the formats. There is no particular format. For example, if you take text is just plain text, right? There is no particular format. In the same way, if you are having any image, the data in the image is not stored in particular format. In the same way, any audio file, any voice file, the data of the voice is not arranged in rows and columns. In the same way, video have data. The data is not organized in any format. So text, image, audio and video data is considered as unstructured data. Next one is semi-structured data. There are some special file formats. One is XML, extensible markup language, which is the language, it is a coding language used to make websites or whatever the web. When you go to a browser and open it, behind that, this is the language used, or this is the code it is used. And also JSON format. JSON format is also a format where sometimes it is structured, sometimes it is not structured. Here we will use certain labels for certain data or certain tags for certain data. This is considered as semi-structured data. This is very important. Based on the structure of the data, it is classified into structured, unstructured or semi-structured data. Most important one for further is this classification of data based on the nature of the values. Based on the nature of the values, data can be classified into two ways. One is categorical data, numerical data. Categorical data is also known as qualitative data. Numerical data is also known as quantitative data. What is categorical data? It represents data based on the quality, character of a person or quality of a person. For example, there is a person in medical field, we collect the gender. Gender can be either male, female or third gender, right? There are three types of gender in medical field. It is a quality of that person. A person can be male, female or other gender. And when you collect HbA1c, you classify the patients into non-diabetic, pre-diabetic or diabetic. This is also character, or this is also quality, whether the patient is diabetic, non-diabetic or pre-diabetic. It is a quality of the patient. This is considered as categorical data or qualitative data. Next type of data is numerical data, where the data represents quantities or values. For example, pulse rate. Pulse rate can be 72, pulse rate can be 140, pulse rate can be 150, pulse rate can be 170, but that is numeric data. This is known as quantitative data. In the same way, weight can be 57.3 kg, 58.3 kg, weight can be 100 kg. So these are the best example. Pulse rate and weight are the numeric data. This is how we have learnt what is data, how do you get data in medical field, whether it is clinical research or whether it is clinical practice, and how do you classify data based on the different parameters. Thank you.